everyone, welcome back to Health Matters. Today we're diving into a topic that affects many men, but isn't often talked about openly: erectile dysfunction, or ED. We'll cover what it is, what causes it, and how it can be treated. So, let's get started. Erectile dysfunction, or ED, is the inability to get or keep an erection firm enough for sexual intercourse. It's more common than you might think, affecting about 30 million men in the United States alone. But ED isn't just about sex. It can also be a sign of underlying health issues. Conditions such as heart disease and diabetes are often linked to ED, as the vascular and nervous system health crucial for erections can be compromised by these diseases. Additionally, psychological conditions like stress, anxiety, and depression can also contribute to ED, creating a cycle of worsening symptoms. Recognizing ED as a potential indicator of broader health concerns can prompt early diagnosis and treatment, addressing not only the symptoms of ED, but also the overall well-being of the individual. Understanding and addressing the root causes of ED is vital for both sexual health and general health maintenance. Let's talk about the causes of ED. There are several factors that can contribute to erectile dysfunction, including physical causes. Erectile dysfunction can be attributed to various physical causes, many of which are linked to systemic health issues. Heart disease and clogged blood vessels, also known as atherosclerosis, can impede blood flow, which is essential for achieving an erection. High cholesterol and high blood pressure further strain the vascular system, exacerbating ED. Diabetes can damage nerves and blood vessels, directly affecting erectile function. Obesity and metabolic syndrome, which involve a cluster of conditions like high blood pressure, high blood sugar, and abnormal cholesterol levels, are also significant risk factors. Neurological disorders such as Parkinson's disease and multiple sclerosis can interfere with the nerve signals necessary for an erection. Certain prescription medications, tobacco use, alcoholism, and other forms of substance abuse can impair sexual function. Sleep disorders disrupt overall health, contributing to ED. Treatments for prostate cancer or enlarged prostate, as well as surgeries or injuries affecting the pelvic area or spinal cord, can directly cause erectile dysfunction. Psychological causes of erectile dysfunction are equally significant and often interlinked with emotional and mental health. Depression can lead to a loss of interest in many activities, including sex, and can reduce overall energy levels and libido. Anxiety, particularly performance anxiety, can create a mental block that makes achieving an erection difficult. Chronic stress affects hormone levels and disrupts the body's normal functioning, contributing to ED. Relationship problems, whether they arise from stress, poor communication, or other concerns, can also lead to sexual dysfunction. It's important to recognize that emotional intimacy and sexual performance are closely connected. Addressing these psychological factors is crucial for effective ED treatment. It's not just about the physical aspect. The mind plays a significant role as well. Sometimes it's a combination of physical and psychological issues that lead to ED. For instance, a minor physical condition that slows your sexual response might cause anxiety about maintaining an erection. The resulting anxiety can lead to or worsen erectile dysfunction. Understanding the interplay between your physical and psychological health can help you address the root causes of erectile dysfunction effectively. If you're experiencing ED, it's important to talk to a healthcare provider. They can help diagnose the cause of your ED and recommend appropriate treatment. Diagnosis typically involves a physical exam and answering questions about your medical history and symptoms. Sometimes additional tests may be necessary. Medications. Common oral medications for treating erectile dysfunction include sildenafil, commonly known as Viagra, tadalafil, also known as Cialis, and vardenafil, which you might know as Levitra. These medications belong to a class of drugs known as phosphodiesterase type 5 inhibitors. They work by increasing blood flow to the penis, helping to achieve and maintain an erection when sexually stimulated. Sildenafil and vardenafil are typically effective for a few hours, while tadalafil can last up to 36 hours, providing a longer window for sexual activity. These medications are generally safe and effective, but should be used under medical supervision. Therapies. Therapies for erectile dysfunction address both psychological and physical aspects. Counseling or therapy is beneficial for psychological causes such as depression, anxiety, stress, or relationship issues. Working with a therapist can help individuals and couples improve communication, manage stress, and address emotional barriers to sexual function. For physical causes, vacuum erection devices or VEDs are a non-invasive option. VEDs involve placing a cylinder over the penis and using a pump to create a vacuum that draws blood into the penis, leading to an erection. An elastic ring is then placed at the base of the penis to maintain the erection during intercourse. Lifestyle changes can significantly improve erectile dysfunction and overall health. Regular exercise enhances blood flow, reduces stress, and helps maintain a healthy weight, all of which are beneficial for erectile function. A healthy diet rich in fruits, vegetables, whole grains, and lean proteins supports cardiovascular health and can prevent conditions like high blood pressure and diabetes that contribute to ED. Quitting smoking is crucial, as tobacco use restricts blood flow and damages blood vessels, exacerbating ED. Reducing alcohol intake is also important, as excessive alcohol can impair nerve function and lead to hormonal imbalances that affect sexual performance. These lifestyle changes promote better erectile function and contribute to improved physical and mental well-being. Surgical options for erectile dysfunction include penile implants and blood vessel surgery. Penile implants involve the insertion of inflatable or malleable rods within the penis to provide a permanent solution for achieving an erection. This option is typically considered when other treatments have failed. Blood vessel surgery aims to improve blood flow to the penis by repairing blocked or leaking blood vessels. This procedure is generally reserved for men with specific vascular issues causing their ED. Both options require careful consideration and consultation with a specialist. Remember, ED is a common issue and nothing to be ashamed of. If you're experiencing symptoms, reach out to a healthcare professional to discuss your options. Thanks for watching. If you found this video helpful, please give it a thumbs up and subscribe to Health Matters for more health-related content.